Greetings, future fossils. This is Michael Garfield welcoming you to another episode of the podcast that explores our place in time. This week's episode is extremely weird, even for me, not because of our guest, the articulate and personable Ira Pastor, but about what he's here to talk about, which is a set of biomedical techniques currently under development that within the next 5 or 10 years could change pretty much all of our assumptions about the treatment of injuries, chronic diseases, and even death. In fact, when we're thinking of where we are in time, one of the things that comes up for me is how in the 19th century, when we first discovered CPR, people got really concerned that we were possibly accidentally burying living family members. And so they started putting these little tubes that people could call through if they were in their grave and suddenly woke up. I remember seeing the diagram explaining how this horn coming out of the ground was connected to a coffin to ensure that nobody goes under unless they're really, truly dead. Well, folks, if you haven't noticed, the last 100 years of discovery have challenged pretty much every hard and fast rule that we thought we had, every boundary imaginable, and that includes the boundary between the living and the dead. As they say in The Princess Bride, he's just mostly dead. And that's starting to look more and more like a legitimate medical statement when you look at remarkable revolutionary technologies like what BioQuark is developing. But also, as we discuss in this episode, a plethora of amazing but slightly more mundane use cases, like regrowing limbs and organs. You know, no big deal. Just the end of permanent disability. Sometimes, even for a guy who thinks as much about the future as I do, I get walloped upside the head with a total black swan like this episode. It's got me thinking in a whole new way about what you and I and our descendants can expect from the human condition. And additionally, it functions as a vital piece of the conversations around radical life extension and the future of treatment and palliative care. Because as more and more new methods like these come to pass, we're really moving out of a paradigm of indefinite treatment by pharmaceutical corporations and into a new paradigm that puts greater emphasis on lasting cures. But before we get into this totally mind-melting conversation, I want to give a short shout out and thanks to the new Patreon supporter, Chris DeLuog. I think that's how you say your name. As well as to Howard Blott, who significantly edited his pledge in my favor this week. Closer than ever to being able to completely support this show through Patreon and the community there, who, by the way, just received a poll about which of the 18 pre-recorded episodes of this show y'all want to hear first, as well as the unedited pre-release episode of the number one choice on that poll, the 2.5-hour conversation I had with my old friend, science fiction writer and legendary psychonaut, the T-Fairy. So if you're interested in telling me which episodes you think should be coming out in what order and scoring access to a voluminous archive of exclusive and early release episodes and music and other goodies, then you can head on over to patreon.com/Michael Garfield and do that damn thing. Or if you can't afford anything in life other than your cell phone bill, you can still be a huge help to this show by heading over to Apple Podcasts or wherever you listen to this and leaving a 5-star rating and review, because that is an excellent and also totally free way of helping me get this podcast into the ears and minds of everybody who'd appreciate it. Also, a reminder that the Future Fossils Facebook group is going off like the 4th of July. New interesting articles and conversations in there every day. About 1,200 people sharing news and cool ideas. It's become my favorite part of Facebook, and I hope to see you in there if you're not already. Well, that's it, folks. Thanks for bearing with me through that. Now brace yourself in whatever way you need to for an update on the paradigm-busting research of BioQuark and the Reanima project with Ira Pastor. Thanks for listening and enjoy. Ira Pastor, it's a pleasure to have you on Future Fossils.
Thanks for having me here, Michael. Appreciate it.
So, what we have not done on this show yet is have a serious, earnest, in-depth conversation about radical life extension and the specific technologies that are moving this out of the realm of science fiction and speculation and into the realm of like a legitimate and timely ethical discussion. So I'm really glad to have you on, and I'd love to know a little bit more about you and your history and how BioQuark came to be.
Yeah, absolutely. So, I come into the industry from a kind of unique angle. I sort of grew up in it as a very young boy with parents that were in the pharmacy business here in the Philadelphia area back in the 1960s. So I was always around sort of medicine and healthcare, and it was sort of preordained that I go into the family business back in the day. So initially I went to school and I became a pharmacist. Subsequently, I went back to business school. And, in pharmacy school, aside from the basics, getting, a little smattering of pharmacology and pharmacokinetics and toxicology and all sorts of interesting things, at the same time, they still taught you quite a bit about pharmacognosy, which is the discipline of studying natural products and sort of their relationships to human health and human healthcare products, of which a large percentage of all pharmaceutical products that currently come out of the industry have their origin from, primarily those from the plant, fungal, and bacteria communities. I was always amazed by this and the fact that, evolution has put these species on this planet. They've survived hundreds of millions, if not billions of years, and they have answers for us in many different sort of contexts. The idea for BioQuark sort of, jettisoned off of that in the sense that, a lot of the smart people would tell us that while we've touched the surface in terms of what the natural world has to offer us in terms of just bioproducts and knowledge, there's a lot more that we haven't looked at. And so, BioQuark was set up to explore some of this, primarily in studying lower organisms that live on this planet with us, which from a health and wellness perspective are just far more advanced than we are when it comes to things like complex regeneration, when it comes to things like reversion of disease. And then ultimately, as you were mentioning, when it comes to life extension, and death, whether those be the negligibly senescent organisms or the organisms that age in reverse, or even some that die and are reborn. And needless to say, we as humans are extremely weak when it comes to many of these skills. And we started BioQuark up with sort of the idea, how could we, with our knowledge of sort of the pharmaceutical industry and drug development, how could we merge some of these learnings in with that dynamic to answer the major questions in terms of human health, wellness, and disease that are still in 2018 knocking on our door, and we don't have too many great answers for yet.
So do you think it's just contingency or like the roll of the dice that we have jellyfish that can unwind their biological clocks, we've got, or rewind them, that we've got salamanders and lizards that can regenerate limbs, but that as human beings, we do not possess these extraordinary capacities for regeneration? Or do you think that you get into this issue with evolutionary biology where, people tend to err on the side of believing that everything that we see in nature
had some sort of function that it was selected for this reason. So do you from what you've learned, do you think that it's just merely blind chance that the higher mammals have lost these profound regenerative abilities, or do you see it as a function of the complexity of our genomic interactions, or what's going on there?
Yeah, I don't think it's much of the genomic complexity as it is that, that critical point in time that evolutionary biologists point to where we became bleeders or much more significant bleeders, in the sense that, we are a species that bleeds very rapidly. We die of loss of blood very rapidly. And we have, from an evolutionary context, developed an excellent wound healing response that is based on thrombosis and fibrosis and stopping the loss of blood very rapidly, balancing out the need for more complex forms of regeneration. Now, that being said, we do have clearly we do have regenerative capability. We have, our typical physiological turnover in terms of our blood and epithelial lining of skin and gut. We have a nice hypertrophic regenerative capability in the liver. But, when it comes to the more complex forms, epimorphosis and morphollaxis that we see in the organisms, no. However, we do, in certain contexts, retain some ability. Where do we see these abilities in humans? Well, for one matter, we see it in the period following fertilization, whereby the biochemical milieu in ooplasm is very nicely designed to undertake the tasks of age reset and epigenetic cleanup and all the other important functions to prepare a new embryo for its transition forward through embryogenesis and morphogenesis and so forth. At the same time, we are learning quite a bit in the last, let's say, 10 years or so, where the topic of cellular competition has sort of reared its head in the biomedical space in terms of how tissues that we have are very good at organizing out and organizing in cells that are preferred versus those that are not. And we see this, although a lot of the papers, are focused on sort of the cancer reversion dynamics that keep us nice and healthy on a daily basis. And, as I like to point out, that as we're sitting here during the course of this conversation, very quietly behind the scenes, we are constantly having these oncogenic reversion dynamics occurring throughout the day. So cellular competition dynamics of this nature point to the fact that while we may not be able to revert huge tumors like we see the salamanders capable of doing, we do have the back and forth play going on behind the scenes. And once again, if it's an area that, if we can harness to do a little more than just the single cellular reversions, this may be very useful for areas like oncology in the future. And this is, one of the areas that we like to study.
So, I'm probably getting ahead of myself by talking about this principally as a life extension issue, because when I look at, you go to BioQuark website and you look at what your company, what your team is actually working on, the in vivo studies are like melanoma, hair loss. The one that interests me the most is traumatic brain injury. So, now it seems like now is a good time to actually talk about the ooplasmic reversion, or however you would put it, the way that you are engineering endogenous repair in the body, and to talk about some of the in vivo studies that you've been doing and what kind of results you've seen. Because this is some intensely fascinating, very kind of cutting edge stuff as far as priming the body to heal from within. Yeah, I'd love to hear you kind of prime the audience about that.
Sure. So, our focus has been on, and once again, we're completely open about the fact that a lot of this is not original research. It goes back to the 1950s in many senses. The concepts and the ideas that ooplasm contains a wonderfully sort of evolutionary perfected basket of biochemical moieties responsible for many of these reversion events.
So you're talking about placental tissue here?
No. We're talking about actually oocyte, sort of ooplasm, the cytoplasm, and other components found within eggs. So the mother cell of all of us that comes before the stem cells. So the biologic dynamics that occur following the arrival of the male DNA via the sperm cell, the egg has to do a lot of things. Reset age, epigenetic cleanup, remodeling organelles, protecting the new embryo from infectious insults, from oxidation, from inflammation. It has major responsibility. It is that sort of basket of, we'll say, possibilities that we are so interested in studying and where we have focused. And once again, it goes back to the 1950s when we first studied such materials in cloning experiments. Most people think cloning and Dolly the sheep in the 1990s, but frogs and other forms of amphibians were being cloned in the 1950s, and studying this potential of ooplasm for this reset, this sort of global reprogramming and reset. So, we have focused a lot on studying these moieties and understanding sort of their role. And once again, we are a company, just as a side note, while the pharmaceutical industry is very interested in mechanism compared to mode of something happening, we are a company that takes the position that mode, when it comes to these complex forms of repair and regeneration, is much more important to study. And too often, I think things get skewed in the opposite direction because we're so interested in knowing what happens at gene XY421 and not thinking of the big picture that incorporates, multiple genes and multiple microRNAs and proteins acting for a certain output. So, we're very interested in the basket of biochemical substances in ooplasm and what they can do, because they do a lot of things in synergy. So we've been studying these materials. We purify specifically ones that are of more interest to us in creating the biologics that we work on. And ultimately, we have been studying the last several years, both recapitulating in the Petri dish a lot of the work that came before us, but now also using in vivo models of disease and degeneration, as you pointed out, with traumatic brain injury models in the lab, some cancer models. We also have some skincare models, but basically understanding how we can administer such a basket of compounds, let's say, to cells that are not an embryo. So basically, we all start off as one cell. It has the same genome as the 50 trillion that we become. Those bioactive substances can affect the genome of all of our cells, and that is what we're very interested in studying, both the reversion dynamics or the dedifferentiation of tissue, and also the signals that allow a cell then to redifferentiate along a certain lineage. So we're looking at both sides of the reprogramming rubber band, as we like to call it. And we've seen some very exciting results in sort of the first stage of our company, in the sense of looking for things that we only expect to see in non-mammals, so things that we would only see in the zebrafish brain or the limb of the salamander and so forth, and translating them slowly into mammalian systems where these dynamics do not occur. So that has been the focus. When you see, yes, we do a wide range of models right now, just because we're shooting kind of broad and looking for a wide range of possible therapeutic targets. Of course, internally, strategically, we have neurology, oncology, and metabolic as three core pillars of the company, but we study a lot of things, either internally or in partnership with other labs. But the core behind it all is how we can, in essence, turn back time in a group of cells in a tissue, and then start over again by then pushing forward along a development path that makes sense, whether it is brain tissue or breast tissue, what have you. And that is the general concept of what we're about, and why we've taken this approach as a biologics company, as opposed to being, say, a stem cell company or a gene therapy company or something along those lines, which we don't think captures the full potential of what we have here.
Yeah, it's an interesting approach in that, and I spend a ton of time talking about this on the show, that there is a reclamation, a kind of a turn towards not an atavism exactly, but a going back to what has been lost, and a sense that if, for civilization to proceed, that we need to go back and do, what in some sense, psychologists would call like shadow work, which is going back and looking at the insights that we have thrown away as we have differentiated ourselves from previous iterations of culture, looking at the ways, the baby that we threw out with the bathwater. And in this case, it's like, it seems that, genetically, biologically speaking, more broadly, that we've kind of thrown out the baby and the bathwater. And that in this case, part of what we are reclaiming is even beyond this sort of cultural retrieval of like going back and looking at lost esoteric techniques and wisdom traditions, going back hundreds of millions of years on one level to reclaim a somatic intelligence that we've lost in our process of evolution. But then also, on this smaller level, this, like you said, turning the clock back to the ooplasm is, I don't know. I don't know how comfortable you are talking in this space, but it seems perfectly in sync with this broader sort of mythic return to an emphasis on the wisdom of the feminine and the body, and the, in a weird way, it seems like this is an integration of sort of masculine and feminine modes, like the analytical mode of science, and this sort of more sort of nourishing, nurturing feminine mode. And then on top of that, also, as far as the drawing from other animal groups, like going back, climbing back down the evolutionary tree to find these branch points and drawing insights from them, seems very much in keeping with a trend in culture now towards deliberate appropriation and remixing, and the sense that, this issue that so many people seem to get wrapped up in around chimeras and genetic hybrids and genetic manipulation is right, clinging to this very sort of, at this point, sort of obsolete or even archaic concept of the human being as a genetically distinct and bounded individual. So that's a hell of a lot to like chew on, but I'm curious how you understand sort of the deeper framing of this work in light of greater trends in science, culture, philosophy, how you understand what you're doing in a bigger picture.
Yeah, and you point out three very important topics, and I'll address all three of them. One, definitely, and I always, when I'm on discussion about this, and if I have a female interviewer, I always talk about, any ladies that are listening to this show, at the point when we discuss ooplasm dynamics and so forth, stand up, take a bow, because you're responsible for all of this. And men, we do nothing. It's truly, you can throw us away in the sort of the Jurassic Park context of it all, that yes, there is clearly a reconnection in that context to the feminine and I wouldn't say the disposal of masculine, but a clear sort of delineation that there is one group is doing something much more important, and whether there is analogies there to, the female lions that go out and hunt, or other proxies on down through the chain. Yes, clearly I'm well aware of that dynamic. And interestingly, just as a side note, a lot of time I talk about sort of the history of all this and how it goes back through the 20th century and into the cloning and in vitro fertilization in the 1950s. What a lot of people don't remember is the 1940s, how many of these technologies were the form of the first pregnancy tests that we ever had. And just to say a real weird side note, a few years ago I was talking to my mother, she passed away when she was 87, but she was telling me, when I was doing this work initially, that her first job out of high school to pay for college was working in a lab where she was washing the urine out of test tubes that this technology was used for to test her pregnancy. So anyway, a little side story there. So there's a connection. But yes, but even going back further, going to the theme of sort of the reconnection, yes, we're not only seeing that in sort of the biologic connection, but even more broadly to the sort of the very physical dynamics, the topics of ancient tools, whether they be light or sound, or more recently, electricity and magnetism. I'd like to point out that, if you and I were to get in a time machine and travel back to 100 years to a biology lab, we wouldn't be hearing a lot about these biologic terms. We'd be hearing more terms that sound like, turn of the century physics. Fields and forces and waves and sort of these really abstract concepts that we are only now, 100 plus years later, reconnecting to the overall hierarchies of how all of this works together, right? Genes don't do anything. They're just pieces of information that take their cues from gene regulatory networks and then cellular regulatory networks and so forth. And what we're seeing now, rearing its head in places like Tufts University or RMIT down in Australia, are these topics of bioelectricity, biomagnetic resonance. We're much more than a biologic entity. We are a physical entity. We are an electrical entity. We're a magnetic entity. We're full of light. We're full of sound. And unless we reconnect a lot of these, I would say, more esoteric concepts to the big picture of what it means to repair, regenerate, and rejuvenate oneself, we miss the big picture if we're just looking at the genes or if we're just looking at the proteins. And I think this has been, one of the major flaws of the industry in the last 100 years and why we are where we are. And then, just coming back to your topic about, chimeras and sort of, the way things are, some of this futuristic stuff that people put on the table. Yeah, I love to point out when, people ask about sort of actionable stuff to do today, I always talk about the fact, what? Don't forget the fact that although we're human, we contain the genome of everything that came before us. And though, everything that helps someone out at some point, whether it's the cats that need large amounts of blood sugar or whether it's the frogs that need large amounts of inflammation because it's their only infectious disease response, or even cancer, which, utilizes the same genes that we see in species that are around 1 billion years ago, like pond scum, Dictyostelium discoideum. You see the connection. We don't need to create chimeras. We are chimeras. We're really complex chimeras. And unless we understand that, and we sort of work around the genome, not just from a human perspective, but from all of the lockdown atavisms and reconnect. There's a reason we had gills and we have tails and we have webbed fingers and toes inside the womb. We need to think very holistically how we approach these complex issues.
Well, I mean, clearly the approach to creating the entire context of the very beginning of something is, that's a very holistic approach. Something else that comes up for me in this also is this sense of, I mean, I don't know how else to put this, that there is, I don't know how your other this Reanima Advanced Biosciences is related formally to BioQuark, but it seems like they're rather intimately associated, and this is the site where talking about neuroregeneration and neuroreanimation research. And there's something in here, like you were just speaking to, thanks ladies, that the Immaculate Conception and the sense of a miracle, and really what we're talking about here is a science of something that, while you may not personally, I don't know, be comfortable with using that language, we're approaching a scientific analytic understanding of how to do things that seemed impossible, and that in the impossibility, it's like I'm not a Christian, but there's the Gospel of Thomas, and in the Gospel of Thomas, Jesus talks about having to become like a child in order to enter the kingdom of heaven. And it's not lost on me. Like, I'm writing this piece right now on neoteny and on how, as human beings have become more and more socially and cognitively sophisticated, we've become more and more paedomorphic, or rather, we've reached social and sexual maturity at levels where our brains and bodies are functioning much more like the immature versions of our ancestors. And we've seen this branch over and over and over, going all the way back to the first vertebrates, which are essentially like the adult form of this free-swimming larva that became the sea squirt. Like, it settles down at some point and becomes a filter feeder, and we didn't. And because of that, we managed to like move into schools and achieve this whole new sort of evolutionary platform. And it seems like something in that turn is going on here, that we are entering a new space of possibility by going into the very beginnings of ourselves, like reconnecting to that origin or that source. I don't know. I'm curious to hear more about neuroreanimation research in particular, and then also if you could double back and talk about specifically the findings with brain trauma and how you're seeing this reversion to the ooplasmic context of cells working in these kind of sweeping, seemingly kind of impossible changes on living tissue.
Sure. So just to briefly touch on what you were mentioning before, though, one of the aspects in this whole ooplasm story of capturing the ancient ability of organizing in and organizing out what is wanted, whether that is in a embryo or whether that is in a regenerating limb or whether it is in a plant that is developing from cell culture. This general theme, you see it across the biologic kingdom. Now, the one very interesting thing, going back to what you were just talking about as sort of the seminal or the originating force, it is well known, and you go into the literature, there is plenty of data out there from the 1980s and 1990s on the ability of ooplasms, both within eggs and also in cell-free ooplasm experiments, to, in essence, reanimate dead biologic materials. I mean, the DNA. You can throw in some, sort of naked DNA into ooplasm, and it starts doing its thing as if it was, part of a cell and copying itself and getting ready to, go on its forward journey. So there really is something neat. Once again, we didn't discover it. A lot of this goes back to the 50s, 60s, and 70s, but it's something that, like many other parts of this space, have gotten less attention than they should have. Okay, just now hopping over quickly to the Reanimate project. This is clearly something that is unique. It came to the table, and basically concept materialized from a few things. One, the decades of knowledge that show that many species on this earth with brains can have them destroyed. Planarians, amphibians, metamorphic insects, even see this dynamic in some small hibernating mammals, only to regenerate in perfect structure and function. This has been known. Simultaneously, since the 1968 Harvard ad hoc brain death criteria was created, if you go into the literature, you will find, primarily in very young infants, several dozen reported cases of spontaneous brain death reversal. These cases are controversial, they are hotly debated, and they never had a good prognosis. But they, in our opinion, point out that when it comes to the topic of death, things are not always black or white with regard to what it means to be alive and what it means to be dead. And lastly, well, on top of the fact that you've had quite a bit of sort of public exposure to the brain death topic in recent years, both with the cases surrounding Whitney Houston's daughter, Bobby Christina Brown, and the Jahai McMath case, you also have an area of research known as living cadaver research, which has gone on for the past couple decades now for primarily using human subjects for a variety of other biomedical purposes, so toxicology, pharmacokinetics, pharmacodynamic studies. We basically wanted to put it all together and say, look, why can't we, with a 2018 tool set, that's focused and has a focus on neuroregeneration, why can't we focus using this model that exists on probably the biggest problem that we have, or the one that clearly gets no medical research funding at all, the severe disorders of consciousness, including the most severe, which is brain death, and the reason 65 million of us leave this world every year. So the Reanimate project is in essence designed based on what we know and what we've seen in the lab with our standard weight drop models of traumatic brain injury, our lesion induction models in Parkinson's disease and spinal cord injury, some of the anatomical neuroprotection dynamics that we've seen in our work with neurodegeneration, neuroregeneration in vitro and in vivo, looking at different biomarkers, inflammatory cascades. Taking all of this into account, why can't we begin to study the use of such technologies for the reconnection of that very critical area that means that we're either dead or alive, the regeneration of the brainstem, which controls our independent heart rate and breathing. There's a major insult to injury when we die. And I know, this is cocktail hour trivia stuff, but when you die, provided, of course, we're not talking about some type of catastrophic death or time-sensitive death, everything below your brainstem is very happy and healthy and chugging along. And in fact, it's been shown that appropriately supported brain-dead subjects can metabolize, can mature, can have a baby, spike a fever, fight infection, do a wide range of things. With all of this in hand, I think it's about time in the year 2018 that we begin to apply technologies like ours and other tools that are out there to how we could re-spark that area that, once it's gone, puts us into a basket of no longer being viable. And so when people ask about this, it is clearly not the core focus of our company, but it is something that we believe 50 years after the definition of brain death was created at Harvard University needs to be explored. And so, we have taken it on as a project of our companies to see how far we can go with this. Because we think some of the answers, not just related to brain death and the more severe disorders of consciousness, whether it's coma, persistent vegetative state, and so forth, but the trickle down to all chronic degenerative diseases of the central nervous system, Alzheimer's, Parkinson's, on down the road, will be invaluable. So it is why we have placed some of our bets in such research. It is different. It is unique. But we feel that in an overall context of disease reversion, repair, and regeneration, it needs to be there as a potential project.
Looking over your history of press releases, publications, podcast interviews, and such, and I recommend anybody who is hungry for a deeper dive after this, go to the BioQuark.com website and check all that stuff out. Looking over this stuff, one of the things that seems surprisingly underrepresented to me in the framing of your research compared to some of the other players in this space is the issue of radical life extension and biological immortality and the rhetoric of regarding death as a disease to be cured by biomedical innovation. I was just at the body hacking conference here in Austin where Liz Parrish of BioViva, I'm not sure if you know her, but she experimented on herself with a telomere extending gene therapy and tours all over, gets up on stage and basically makes this case, which is a strangely compelling case in the voice of a mother concerned about finding cures for childhood disease. Suddenly, this Aubrey de Grey conversation about death, or the Ray Kurzweil conversation about death as an abomination becomes in like Liz Parrish's mouth a humanitarian crisis. And yet your company seems so much more in a weird way, one, pushing even more radical treatments with more radical promise, but then on the other hand, keeping those promises rather close to the vest and looking at this more within the context of caring for aging parents and treating failed organs and that, regenerating a lost hand and that kind of stuff.
Yeah, I mean, and it's not that we're ashamed or afraid of discussing. I mean, I'll hang in there with anyone and can talk about that for for ours. The issue for us is that radical life extension becomes a side effect of our work. So clearly, the ability to turn back time in a tissue, whether it's a kidney or a liver or a heart, the brain, spine, whatever, in essence, makes it younger, rejuvenated, and starts, a la the immortal jellyfish, starts things over at an earlier stage. We're completely aware of that and are, pro sort of the anti-aging side effects of what we do. Where we differ a bit, and I hang in the same circles with a lot of these folks, and once again, it goes back to what I mentioned early on in the discussion. We don't believe that the aging problem can be solved at its outputs. There may be very excellent therapies that come out of that, but in the same context, and although I spent my time in the pharmaceutical industry, and I am a critic of the pharmaceutical industry today a lot because I know its problems. My personal feeling is a lot of what goes on out there right now in the life extension community is still quite close to what big pharma does. And I don't know if they've set themselves up just because they think that's the right model or what have you, but once again, I don't believe the answers in the long term are going to be to do these things the same way that pharma does and looking primarily at genomic outputs or slightly up the upstream from that in terms of damage. I think there's good therapies that will come. Whether they will extend your life dramatically, I don't think so. I think if you want dramatic life extension, you have to go far up the river to, as I mentioned earlier, the architecture that controls all of the trickle down. And I'm not just talking about, I'm not talking about Aubrey de Grey's little, chart of, metabolism, damage, and pathology. But I look at it, if you take Aubrey de Grey's little thing and you put that inside a circle as one cell and then begin to think, okay, we are 50 trillion of these little packages, how one addresses a 50 trillion cell organism in a translational context. Because it's not about more small molecules or other sort of very targeted pharma-style interventions. Yes, I'm a proponent of radical life extension, and I'm not one that hides behind health span versus lifespan and all that stuff. But I do believe that we have to think a little broader than the current folks are thinking. And at the same time, you're not going to have radical life extension without anti-death at the same time. And a lot of it is focused on the anti-aging part of the equation. I understand why. But at the same time, while they talk about the 100,000 that die of aging every day, you have to keep in mind that 50,000 also die of acute trauma every day. And unless you solve both sides of that, you have to solve both aging and death reversal to truly have radical life extension. Hence why we work in both. So everyone jokes, well, I'll just, you got to make sure you're not going to get hit by a bus and so on. But I say to myself, no, we have to solve what happens when you do get hit by a bus, because that's what's going to happen when you don't get cancer anymore and you don't have Alzheimer's anymore, because you're going to get hit by the bus. It's just what's going to happen.
So some of my favorite biohackers like to parade around with the pretense that they are black hat biohackers, to indulge in the sort of, biopunk dystopian fantasy. But I mean, to me, that makes them ultimately a positive benefit to the conversation, in the same way that dystopian science fiction helps us avoid particular cultural or social pitfalls. So, I mean, somebody who works as closely with this stuff as you do, I'm really curious to know, you must have spent in your time with this some time contemplating the horrible potential consequences, ways that this technology could be, abused or weaponized, or could lead to sort of undesirable secondhand social outcomes. And I invite you to just kind of go out on a limb here, if you've thought about any of that stuff, and look at what could go wrong in the deployment of a technology like this. It's one of these things where it's like, it seems just so remarkably beneficial, but then of course you get into issues of access and haves and have-nots, et cetera, as just one very obvious and easy thing. But Let's say everyone had it. What could go wrong?
Well, just let me answer the haves and have-nots for a second. So I want to make one point about that. When we set this company up, although we realized we were looking at a 21st century target, let's say, or outcome in terms of some of these dramatic benefits, we made sure to set the company up as a traditional 20th century biologics company. We realized that, well, the science also told us not to go in that certain direction, but we realized early on that it would make no sense per what you're seeing nowadays, $2 million shot gene therapies and all this other stuff, that to build a company that was based on 100 people in the United States being able to afford it and so forth, and most insurance companies rejecting it off a formulary, even if it was approved, didn't make a lot of sense. So we are set up, and the strategy of our company moving forward, we will never be any more expensive in terms of what we're developing than any other biological on the market today. So I point out, if your healthcare system covers insulin, if it covers vaccines, if it covers human growth hormone, you're going to be able to afford what we do because we use off-the-shelf biologics development technology from the 1970s. So there's nothing here that's going to be a ridiculous, multi-million dollar a pop procedure. So people should be happy about that. This is access for everybody. This is not just for the billionaires. As far as negative outcomes, I think we're, once again, I think we're in a pretty decent zone compared to the problems that come with some more exotic tools, whether they're gene editing or some of these other modes of therapies that have a translational barrier in terms of how you deal with 50 trillion cells. Craig Venter has this great quote: "We are not giant amoebas." It's one thing to use CRISPR on a couple cells in a petri dish, but when you have 50 trillion you're dealing with, the dynamics change. Hence, once again, why we wanted to put ourselves in something that is much more well-known, with biologic moieties that the genome knows, has seen. And from a sort of pharmacologic perspective, the worst sort of side effect type profile one could ever experience would be, slightly exaggerated pharmacology or something along those lines, as opposed to, a gene inserting in the wrong place, even though CRISPR is supposed to be so perfect, and, not finding out about what's going on until things get out of control. So I think from a straightforward pharmacotherapeutic perspective, we are on pretty strong footing. Now, people will, of course, throw Hollywood scenarios out there. Clearly, we got a lot of the zombie type stuff going on last year. And I like to jokingly point out, look, if you want a zombie, there are plenty of FDA-approved deliriants that will do that for you today. There are plenty of bacteria that will cause that effect today. And hey, I can drive around today and see many people on their cell phones just driving with their head down. I think that's a little worse of a zombie than anything that could come out of any of the work that we're doing. We can go on and we can talk about social implications of radical life extension, so forth. You probably got into that topic with a lot of other people, and I'll be glad to go in that direction. But I think intelligently done, with the right balance of therapeutic potential, we have the ability to have a much, let's say, wider, not just therapeutic window, but social window on how this tool and the resulting therapeutics will be deployed versus others. And the last thing, one other thing I want to point out, if you, along the lines of your weaponization question, one only needs to point out that the most poisonous substance known to exist on this planet, botulinum toxin, is now a multi-billion-dollar-a-year product used by women for all sorts of purposes. Things go full circle on this planet. And whether it's Botox or ricin or mustard gas, they're all therapeutics nowadays in the pharmaceutical market. So, we'll see. But I don't think there's anything weaponizable, anything we do.
Oh, wow. So something that comes up for me in considering this, and maybe this is a drop in the bucket compared to like other ways that this is a concern, but surely if we were able to deploy on a planet-wide scale this type of therapy, and this is something that seems to have kind of no boundary, like no edge to the scope. Like it seems as though this is something that's going to revolutionize the medical approach in every system of the body, in every area of medicine. So I look at this and I just think, my God, the turnover in medicine, just in terms of the shakeup that this would do to the current lay of the land in terms of the jobs and the roles that are available to people working in that space, seems rather extensive. That you'd be, best case scenario is, you're putting a lot of, morgues and funeral homes out of work, in addition to surgeons and pharmacists and et cetera.
Yeah, I see a separate industry developing out of this, and people always ask about, well, you're from the pharma industry, are you going to sell out when you have positive phase 2 data, and is the stuff going to get buried and all this business?
A vital question.
Yeah. I mean, I think what you're going to see is really two industries develop. You're going to see one that maintains the need for your cholesterol lowering and your blood pressure and your antibiotics and your painkillers and everything else that we traditionally think of as a treatment. We still need those treatments for the symptoms of disease. That industry will shrink. It will be made up of your traditional pharmaceutical companies, but they will, and they've done this to themselves. It's going to be a side effect of both their decreasing market presence due to generic competition, as well as the fact that they've basically thrown out so much internal R&D that they're just these marketing shells nowadays. So they're going to shrink a lot, but they're going to maintain a business based on sort of this treatment-centric approach. Then there will be a different business, and that business will be curative. What form it will ultimately take, how integrated it will be with, the healthcare industry versus the pharmaceutical industry, whether there will be devices or other tools that we can only begin to imagine, is still up for question. However, yes, people in different fields will not be in those fields anymore. I am one that says I hope we will get rid of all organ transplantation one day. If we can. Although there's sort of this ex vivo organ engineering dream where, they hope for you one day, Michael Garfield, to have a refrigerator of hearts and kidneys and other stuff that is, tissue matched and made your own stem cells and all that business. At the end of the day, I say I'm not interested in any of that. If I can repair and regenerate the kidney, the liver, the heart, the brain that you have currently, you don't need parts sitting somewhere. So, we hope to get rid of organ transplantation as an example. And if we get rid of organ transplantation, we're going to get rid of the dialysis business as well for kidneys. And we're going to get rid of artificial pancreas technology. We're going to have an impact, obviously, taken to its logical extreme. But that will create new opportunities. I'm not afraid of that. But once again, I think we are beginning to see the tide turn, in the sense that what we used to think of as the pharmaceutical industry, in sense of little white pills in plastic bottles dispensed at your local Rite Aid, is not going to be what is going to be around 10, 20 years from now. And when you see things like my former employer at GlaxoSmithKline, electroceutical programs coming online, when you see things like there's the PureTech organization up in Boston, which is creating in terms of the microbiome products, actual cocktails of live bacteria that is going to be the therapeutic. And you even see things, I don't know how many people know that, leeches and maggots are currently FDA approved for debridement of non-healing skin wounds by FDA. So there's a lot of weird stuff out there that's quietly happening behind the scenes, where people are saying, you know what, a drug doesn't need to be this little white pill anymore. It can be other stuff. And it's going to have to be other stuff when it comes to these more complex forms of intervention. So we're excited. We think things are going in the right direction. And what everything's going to look like 20 years from now, I can't say, but it will look different. And people will have different types of jobs.
How do you think it's going to affect us in the next, in the short term, like in the next 2 to 5 years? Are we going to start to see any of these treatments become publicly available in that time frame, or what are we waiting on as far as the clinical trials and so on?
Well, our clinical plan in the United States, we have 3 years till first in human, 5 years till registration. So our U.S. program is a little longer than some of the things we are studying in terms of ex-U.S. possibilities, but still, that our belief is, and our strategic plan calls for orphan fast-track indication number 1, registered within 5 years. And, if you have an impact in, let's say, kidney regeneration, kidney remodeling in an orphan condition, based on the way this industry works, that trickles up to, the kidney as a whole, which, the $60 billion market alone to play in. So we think that once the data starts coming in from some of the initial indications on inducible endogenous regeneration events, things are going to explode. We are also ex-US. We're a US company, but this isn't the 1980s anymore. While drug companies would only focus on the US and putter around a bit in Western Europe, they forgot about the rest of the world back then. They didn't really care about it. The really smart people will tell you nowadays that if you're not at least researching the rest of the world to know what's going on in, with conditional approval in Japan, or, what are the rules in Indonesia versus Colombia versus Turkey, because these countries are coming online fast and furious with regard to their markets. And combine that with the fact that you have this increased globalization now of medical research and training. So, you have Harvard Medical School operating in Dubai, and Newcastle Medical School operating in Malaysia, and dozens of U.S. institutions opening up in China. It's a really weird and unique system we're getting into in terms of medical research in 2018. And it's no longer, hey, I need to spend $1 billion in the US to get my project done. There's 200 plus other countries out there, and the United States is the 19th country we register in, so be it. There's a lot of possibility out there now. So we're excited. And I like to point this case out. I don't know how many people are aware of sort of the relationship that Merck, the 5th largest drug company in the world, formed with the government of China last year.
No.
But they basically they set aside an island, this Hainan Island, which is sort of this tropical hub for sort of medical tourism, pharmaceutical tourism. They get the 5th largest drug company in the world that basically is making some of their immunotherapies for cancer available to people that want to biohack. God forbid you have stage 3 pancreatic cancer, but you can now travel to Hainan Island off the coast of China and access these therapies pre-approval in the United States. So it's a really unique situation that we see, and we have to be everywhere. We have to really know what the possibilities are, because it's we love the United States. We're a U.S. company. We'll always be a U.S. company, but we have to be elsewhere as well. And
now also in the U.S., we have right to try also, correct? Like my understanding is that even if it hasn't cleared the final stages of FDA approval, that if you are a terminally ill patient, that you now have the legal right to pursue at your own cost experimental treatments that you may not survive to actually see hit the market.
Right. The issue, my understanding with right to try, is you still have the sort of the expanded access problem where, you can knock on whomever's door, J&J or Pfizer or Merck, and they can say no. While over in, we don't want you dying in, as patient 101, we don't want that data point in our clinical trial in the U.S. While what I understand is going on in Hainan Island in China right now is you go and you take a vacation and you want Keytruda or whatever, you want to try it for X cancer. Here you go. Hey, done. And it's not a clinical trial per se. It's, as you were saying about biohacking, it's sort of like N of 1 biohacking patient. So right. It's a little different and creative, in my opinion. So
Fascinating. So I like to end all of these episodes by inviting guests to spend a minute musing on how you hope your work is understood in light of history. Like what trees are you planting now? And I think we've pretty much spent this whole conversation explaining this, but to let you tie a bow on it, if your life's work is understood as planting a tree that you'll not live to eat the fruit from, what is it that you hope you're remembered for, or how is it that you hope your life is understood by people living in 100, 200 years?
Well, I hope if I don't live to see the fruit of these efforts, that my children will. 3 lovely children, and I usually talk about the fact that one of the things that got me so interested in taking this step beyond the comfort of the traditional pharmaceutical industry was seeing my father go down to spinal cancer, my mother go down to chronic lung disease, my maternal father, heart disease, and so forth, and understanding that a $1 trillion industry that I was working in was providing no answers for any of this stuff. I hope that if I do not live to see the fruit of this, that my children definitely will. And when, my daughter is 250 or however old she will be in the radical life extension era, that I will be looked back as somebody that wanted to make a difference and was willing to risk breaking down some of the sort of the established thinking that created the problem in the first place. I think that, let's say, radical life extension in general is an important goal for the future of humanity per the elimination of degenerative diseases associated with aging and death, and sort of realizing the, sort of the transhumanist ideal and so forth. But we really need to think outside the box and not fall into the traps that the old system, the traditional pharmaceutical industry, its regulators, and a century-old model of drug development has put us in 2018. And that there are a reason, coming back to the very beginning in our evolution of biology, there's a reason that microbes and plants and invertebrates and so forth have survived for hundreds of millions of years on this planet and developed their answers to many of these problems that plague us. I call them nature's transhumanists. They've shown us the way. We need to follow their lead. And if we can do this, it's going to be a very bright future. And hey, if I don't see it, I hope I'm remembered for helping to create it.
Well, it's beautiful. I'm honored to have had the opportunity to speak to you today, Ira, and I'm glad to share your work with this audience. Thanks for joining us on the show.
I really appreciate it, Michael. This was a great time.
Yeah, thanks. Thanks again for listening. I hope you enjoyed that episode as much as I did. Future Fossils is part of the MindPod network, along with Third Eye Drops, the Astral Hustle, Synchronicity Podcast, and an oodle of other fascinating programs. I encourage you to go to mindpodnetwork.com and subscribe to them all. And stay tuned, because we have some awesome episodes coming up on Future Fossils. So stick around and have a most excellent year.